So without further ado, Dr. Rory Soares.
All right, if you'll give me a second to get this picture of my baby off of the screen here. Okay. I would say that probably the most important name for you to take away from this session is not mine, but Elena Golding's. Elena is, I don't think anyone can say enough about what a great individual she is and how important she's been in allowing us to bring this forward. And any of the patients in the room who have dealt with Elena know this to be the case. So I think Elena deserves a hand before we go any further. I'm the section head for interventional radiology at a big hospital down in Providence, Rhode Island, about a 750-bed hospital. And my area of specialty is venous disease, and I've treated venous disease since 1997. The treatments for CCSVI and getting involved with treating that part of the venous system started for us in July of last year, so about a year and a half ago at this point, using essentially the same techniques that we've used for many years in other parts of the body. The place where we do most of our interventional treatment for CCSVI in the setting of multiple sclerosis is the Rhode Island Vascular Institute, where I'm the medical director. But I would be remiss if I didn't tell you that I have, and most of you know this, a lot of you who are patients or scheduled to be patients, I have 9 excellent partners. We're a very big group. We're the largest interventional radiology group on the East Coast. And I work with the best guys there are in the world as far as doing this stuff. So I think those guys really deserve to be recognized. This is really their work as much as it's mine. So the first thing I would like to do is, and I don't know if I even need to ask this question, but how many people in the room either have multiple sclerosis or are touched by having a loved one with multiple sclerosis? Is there anyone who isn't? Yeah, that's incredible. You guys are really amazing to, this is cold weather for me. We got up here, it's a little colder than it was, and last night it was like a hurricane, so I have to say, you're really incredible getting out here, and I understand this is nothing for you, huh? You get real snow, so thank you. That's not the bravery that I was talking about here, although you are brave. The bravery that I was talking about is the bravery that you've all, I think, shown in helping interventionalists, whether they're, neurointerventionalists, interventional radiologists, cardiologists, in helping them to push the envelope of medicine a little further along. And I think that none of this happens unless patients form a partnership with their physicians. So you really should congratulate yourselves on being willing to do that. So thank you for letting us talk, but thank you more importantly for being willing to try the new frontier as far as medicine is concerned. Tonight I'm going to present a little bit of an overview, a history of CCSVI. A lot of this you will know as much about or more than I will. A discussion of the most current definition and theories of CCSVI. And then I'll talk about the diagnosis and treatment of the CCSVI at Rhode Island Vascular Institute. I'm going to end off with a little video vignette, a little video clip of the experience that you could expect at our institution at Rhode Island Vascular Institute. It was put together in such a way that I hope what it does is allow patients and loved ones to get an understanding just how minimally invasive this treatment is and what they can expect at most outpatient facilities, because I think that this is a similar experience to what you would get anywhere. And it should allay some of the anxiety that patients feel. Steve and I were talking at dinner before we came over today, and he was patient number 1 here in Canada, and so his anxiety level, I'm sure, was through the roof. But I just think it would be a lot nicer for most patients if they had some idea of what it is that they're going to experience before they get in there. So that's why we put that together. So history. The first thing I want to do is ask anybody in the room if they know Sal Sclafani. Anybody know Sal? Anybody met Dr. Sclafani? I have to tell you, it's an amazing thing, but this is Jean-Martin Charcot. You guys will pronounce that a lot better than I will. But Dr. Charcot looks exactly like Sal Sclafani. I mean, it's crazy how similar these two guys look, even with their haircut. I say a brief history of CCSVI here, and really that's a misnomer because CCSVI, or the concept of a venous relationship with MS, has gone back at least to the middle 1800s. When Dr. Charcot pointed out the fact that most of the multiple sclerotic plaques that he saw in pathologic specimens were around the veins. They were venocentric. They were around the veins in the central nervous system. So the concept of a venocentric disease, or a disease that was somehow related to veins, is a very old concept. More work was done during the early part of this century by a real iconoclast here, Dr. Tracy Putnam. Can you, I don't know why that keeps going out on me. Is it on a delay? As long as it doesn't go out on its own, I'll be okay. Okay, okay. So Dr. Putnam, for those of you who don't know, was the chair of neurosurgery and neurology at Columbia Hospital for Physicians and Surgeons in New York for about 13 years in the 30s and 40s. He's very well known for having discovered epilepsy and the treatment for epilepsy of Dilantin. He's not very well known for having pushed the idea of a multiple sclerosis being a venocentric process. And he actually felt strongly enough about this so that he did a lot of work in animals in recreating multiple sclerosis plaques. He was able to recreate multiple sclerosis plaques in the brains and spinal cords of experimental animals by blocking the outflow from their central nervous system. And this was in the 1930s. This is the quote that I took from him. He has a lot of great quotes, but venular obstruction, narrowing or blockage in the veins, is the essential immediate antecedent to the formation of typical sclerotic plaques. I think that's pretty prophetic. He was probably a little more prophetic when he said in 1938 that multiple sclerosis, the history of multiple sclerosis, has not been completed at this point. There's a lot more to write. But he followed it up by saying, but neither is the history of medicine, so we should keep working on all of this stuff. He was actually drummed off the faculty at Columbia because people thought he was too out there in terms of his theories. So now we get up to a little more modern history here, and this is Dr. Paolo Zamboni. And Dr. Zamboni in 2009 reintroduced the concept of a venocentric component of multiple sclerosis with the concept of CCSVI, chronic cerebrospinal venous insufficiency. And he said this detected reflux propagated from the chest and neck veins into the veins of the brain was found strongly associated to the most common cause of disability in young people, namely MS, multiple sclerosis. And most of you know his history. He has a very high personal stake in the treatment of multiple sclerosis, having treated his wife's jugular veins, who was is an MS patient. Dr. Zamboni's definition of chronic cerebrospinal venous insufficiency, or CCSVI, because it's really much too hard to say that whole long thing, is a syndrome characterized by stenoses. Stenoses mean narrowing or blockage of the IJVs, the internal jugular veins, and the azygos vein system with opening of collaterals, those are detour veins, and insufficient drainage from the nervous system. And this was from a very recent article in Phlebology where he reiterated his definition. I think a little bit more concise and a still very accurate definition was put forward by Marian Simca at the CCSVI symposium in New York last summer, and he said that CCSVI is a functional or structural abnormality of the veins draining the central nervous system. I think this accurately describes CCSVI. You'll notice that this does not mention multiple sclerosis, and I think that I won't go as far as saying CCSVI is not MS, and there are a lot of people who make these kind of statements. I think that what we can say is that there is a strong association between, and I'm going to show you some data to support this, between CCSVI and diseases like multiple sclerosis. I think multiple sclerosis could very well turn out to be the tip of a big iceberg in terms of neurodegenerative disease, but what we can say is that there's an association, and we're going to talk a little bit about why that occurs. On the left here is a very beautiful Frank Netter diagram. This is a drawing of the jugular venous drainage in a normal anatomic specimen. And what I would point out to you, in addition to showing you the jugular vein here, is the fact that the jugular vein really doesn't change in size significantly as it takes on tributary veins tracking down toward the clavicle. And it certainly doesn't become more narrow as it crosses the clavicle in a normal specimen. And this is a very good representation. Anybody who knows the drawings and the work of Frank Netter knows that if nothing else, he is accurate. His drawings are just amazing how close they are to reality. You don't really realize it until you spend time in an anatomy lab, but I will tell you, it's true. It's a wonderful, wonderful artist. On the other side of the screen here is a drawing of what's called the vertebral vein, which is really more of a vertebral plexus. Very, very important, small vertebral plexus or combination of veins that drains through the bones of the cervical spine. And both of these systems are important. There's one vertebral vein on the left, one vertebral vein on the right, one jugular vein on the left, one jugular vein on the right, and they take over the drainage from the central nervous system. And this diagram, I think, nicely shows how it works. The blood flow should come mainly from the jugular veins, back across into the superior vena cava, and the blood flow from the vertebral vein should drain down and then eventually through this, which is the azygos vein. This shape here that kind of looks more like a T is the candy cane that people talk about when they talk about the azygos vein. I'll show you some more pictures of that later, but this is the normal situation. This is how the blood should leave your central nervous system, or at least the brain and spinal cord portion of your central nervous system. This is what should happen in a normal patient when they go from this position, which we call supine. Laying on your back is supine. When you go from the supine position, 85% of your blood flow from your brain in the supine position should be through the jugular veins. And we show that here by just demonstrating really puffed up veins, big diameter veins, and a big arrow representing most of the flow leaving in that direction. Very little flow, 15% or so, coming out through the vertebral veins, okay? When we stand up, what should happen is this system is designed so that when you stand up, your jugular veins collapse. And very, very little of the flow in your jugular veins occurs when you're in the upright position. All of it should occur really through the vertebral plexus when you go from supine to upright, so laying down to upright. Okay? In CCSVI, chronic cerebrospinal venous insufficiency, when you go from supine to upright, this system doesn't work. Basically, you have several possibilities, but you have a situation where if there's a blockage at the typical level in one of the jugular veins, more of the flow will attempt to go through the other jugular vein, or perhaps through the azygos vein, or in the more common situation that we see when there's an abnormality, and this level where we're showing the abnormality here, that's the level where the valves are located. So if there's an abnormality at this level, more often than not, what we'll see is almost all of the flow going through the vertebral veins, and that's what's called collateral flow. And then the other situation that we show here is where there's a blockage in the upper level of the jugular veins, high up near the skull base. We don't see this pattern very typically. That's much less common. And frankly, I think a lot of patients who have pictures presented to me anyway, where narrowings and blockages are being described at this level and at this level of the jugular vein, those are normal anatomic narrowings, and they're caused by structures that cross the veins at that level normally in all patients, patients who have CCSVI and those who don't, which also makes treatment up at that level a little less likely to be effective. Dr. Zamboni described the big idea. There were a couple of articles that called it the big idea, and I think this diagram very, very nicely encapsulates how this whole process works. This part of the diagram is what we've just finished talking about, abnormal venous blood flow, okay? So this is what I would describe as CCSVI. The rest of the diagram is how we get from CCSVI to the immunological response in multiple sclerosis plaques, okay? There is abnormal venous blood flow, which results in increased pressure in the veins within the nervous system. When the pressure in the nervous system veins increases, the normal tight connections between the lining veins, the lining of the veins in the nervous system is spread out by this pressure, and red blood cells, RBCs, are allowed to leak through these spaces between the what's called endothelium of these veins. So basically what we've done is take a nice blood-tight barrier, the blood-brain barrier that you've heard about, and we've allowed red blood cells to leak into an area where they should not.